A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a startling revelation, new data indicates that the fertility rate in England and Wales has plummeted to an unprecedented low of 1.41 children per woman, raising significant concerns regarding the implications for Britain's aging population. This figure marks a decline from 1.42 in 2023 and a stark drop from 1.94 in 2010, which was the last peak in fertility rates. The total fertility rate must hover around 2.1 children per woman to maintain a stable population, excluding the effects of migration. Alarmingly, not a single local authority district achieved this threshold last year. The town of Luton recorded the highest fertility rate at 2 children per woman, while areas like Islington, Brighton and Hove, Cambridge, and the City of London reported rates below 1. Despite a slight increase in the number of births, which rose from approximately 591,000 in 2023 to nearly 595,000 last year, the overall fertility rate continues to decline. The implications of a dwindling birth rate are multifaceted, posing significant challenges to Britain's economy and public services. For instance, many primary schools in London have been forced to close due to a lack of demand, while the National Health Service, NHS, faces escalating expenses related to an aging population, diverting resources away from maternity care. With fewer births, the nation anticipates a future with a reduced workforce contributing to tax revenues, which are essential for funding benefits and services for an increasing number of pensioners. Economists have expressed concern that lower birth rates in an aging population could hinder innovation and economic growth. Martin Beck, chief economist at WPI Strategy, emphasized that fewer births today would result in a smaller pool of workers in the future, potentially leading to labor shortages. This situation complicates the government's balancing act between the economic benefits of immigration and the social and political ramifications of relying on migrant labor. Bridget Phillipson, the education secretary, recently urged citizens to consider having more children, attributing the declining fertility rate partly to the rising cost of living. She announced plans for more affordable childcare through a new wave of school-based nurseries, aiming to alleviate some of the financial pressures on families. The post-war baby boom saw the UK's fertility rate peak at 2.93 in 1964, but it has been below the replacement rate of 2.1 since 1973, with no signs of recovery. The decline in fertility rates is not unique to the UK. Many affluent countries have experienced similar trends in recent decades. The average fertility rate among OECD nations has dropped from just above 2.1 in 1980 to 1.46 today. Among the 38 members of this developed economy group, only Israel boasts a birth rate above 2.1, while South Korea records the lowest at a mere 0.72 children per woman. The recent data from the Office for National Statistics reveals that the fertility rate for England and Wales has reached a new low after 3 consecutive years of decline. With natural population growth expected to dwindle further, projections indicate that deaths may soon surpass births by 2030. Although migration has contributed to a population increase of approximately 706,000 in the year leading up to mid-2024, the fertility rate continues to fall. Significant disparities exist in fertility rates across different regions, with Luton leading at 2.0 children per woman and the City of London trailing at a mere 0.32. Notably, all areas fall below the stable fertility rate of 2.1, with Scotland also reporting a record low of 1.25 last year. The UK is experiencing one of the steepest declines in fertility rates among G7 nations, with a 25% drop since 2010. The average age of first-time mothers has also risen, from just over 26 in 2000 to over 29 today, with women in London averaging 31 years old when they have their first child. The average age for a second child in the capital is now 33. Areas around Manchester, Birmingham, and parts of southeast England report higher fertility rates, while central London authorities exhibit some of the lowest figures, hovering around 1 child per woman. Recent polls indicate that financial pressures are causing many couples to delay starting families, with 4 in 10 couples citing economic concerns as a significant factor. This trend raises questions about the future of the workforce and economic stability in the UK. Reform leader Nigel Farage has proposed drastic measures to address the issue, including slashing migration and fast-tracking deportations, which could exacerbate the already dwindling fertility rates. His party's commitment to abolishing the two-child benefit cap is part of a broader strategy to encourage higher birth rates. Last year, England and Wales recorded approximately 568,000 deaths, suggesting that the population would have barely increased without net migration, which added 431,000 people during the same period. A spokesperson for Reform recently acknowledged that significant cuts to immigration would necessitate a boost in birth rates to avoid a potential population crisis, stating, "To fix that population crisis, we're trying to encourage British people already here to have kids." As the UK navigates this demographic challenge, the implications of a declining fertility rate will likely reverberate across various sectors, from education to healthcare and beyond. The government faces the pressing task of addressing the root causes of this trend while ensuring a sustainable future for the nation. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.